All right, now we're going to talk about cancer. So what I'm really going through is the key points that you have in each module, and I'm going over more detailed key points. Things are really important to know for cancer in general. You need to understand the pathophysiology behind it. So I'm not going to go into complete detail about the pathophys since you took patho already, but just some key differences. Understand the key differences between benign and malignant. Remember, benign is not cancer. Malignant is cancer. So, now with both of these, there's a dysfunction in the cell, but this is more of a major dysfunction in the cell. The cell changes. All right, so a benign is a normal cell. It's normal. And remember, the cells replicate. So in cancer cells also replicate just like normal cells, okay? But they can replicate and not look right. They can be different sizes, different shapes, but they do normally replicate at the same rate. All right. Malignant cells, these always produce at the same rate. These produce at the same rate most of the time. Sometimes they don't, but usually they will. They look different, right? Because they're not normal cells, so they're cancer cells. It's called a defective cell proliferation. So don't get that confused with growing faster than a normal cell. They're defective. They're not going to function correctly. And these will end up multiplying haphazardly, like the key points say. So the other thing is these are well differentiated. These are not well differentiated. So understand the differences between the two. Okay, so when you have malignant cancer, let's just say, let's see, what can I draw? Not much. All right, I'm going to draw a kidney here. It's like here's a kidney. All right, so we have cancer in our kidney now, all right? And what happens with this? If you don't catch it right away, it can metastasize. There are some cancers that we call in situ, meaning it's encapsulated, like thyroid cancer can do that, breast cancer can do that. Also, prostate cancer can encapsulate itself. But anyways, let's just think overall. You can have malignancy with metastasis. And what does that mean? It goes to other organs. Remember, we're very vascular. We have a lot of blood vessels going through, and these cells can get into the blood vessels, get into the bloodstream, and then start depositing in other organs, which I cannot draw liver, but let's just say it gets to the liver. And it usually, because it gets into the bloodstream and the lymph system, so bloodstream and lymph system, and it travels around your body, and then it'll just deposit. Usually it will deposit where the next place goes, where it's closest to. So like if you have breast cancer, it usually will metastasize to the brain or the spinal cord, what's near it. If you have prostate cancer, it's more or less to go to the bone. There's different types of staging, which I'm not going to get into details with, but I want you to understand how these are treated. There's different modalities, and it depends on what type of cancer will depend on the modality that's used. Most common modalities are chemotherapy, radiation. There's also seed implants, brachytherapy. So what I want to go through now is the treatments real quick. So we have chemotherapy. Remember, chemo kills bad and good cells, so that's why it can be very difficult for this patient. You have to there's a lot of precautions with this. For chemotherapy, there's oral medications that are chemo, but there's also a lot of IV medications, all right? So when we give chemotherapy IV, you usually should have like a central line or a port. Why? Because you want to avoid extravasation. It still can happen, so you want to watch it like a hawk. Extravasation. Watch the IV site. All right. And what happens if you notice, even if it's a little bit red, you will stop it right away. Stop the IV immediately. So you're giving chemotherapy. This patient comes in, they have breast cancer and they're ready for their treatment. I'm going to say, okay, did you take your Zofran before you came? Let's give you some IV anti-nausea medication because they can get nausea. So we want to prevent anybody with cancer. We try to be very proactive because we don't want them to feel worse than they already feel. So antiemetics, 30 to 60 minutes before. Okay, anytime prior, you want to give that to avoid them being sick. Also, with this type of patient, remember they go through cycles, so it depends on the type of medication. So maybe at the end of week 1, that's when it's really hitting, kicking in, the peak of the drug. And so remember, it kills all cells, so you can get neutropenia. What is that? Decrease of white blood cells, as well as the other breakdown of the white blood cells, but now you have our increased risk of infection. So you want to make sure you stay away from like fresh flowers, anything that can cause bacteria. You want to stay away from anybody who's sick. And you're going to monitor, you're going to tell this patient that they need to watch their temp all the time. Any increase in temp, you're going to call the doctor, because we don't want that to happen, this patient to go septic on you. Patients are tired, they have diarrhea, they have mouth pain, and they lose their taste. So with losing their taste, that can be very challenging and depressing for the patient. So what you want to do is try to stimulate, like if you take like a lemon or a sour ball or eat a Sour Patch, how it's like all of a sudden your mouth is watering. That will help. Anything strong, even an onion will help, lemon drops. So make sure you read up about that too. These people also are in pain. This is one time that you don't worry about opioids. You give them their opioids. You give them their morphine and give them breakthrough opioids as needed, because you want them to be comfortable for sure. There is something called the symptom management model. I hope you can see this. Maybe not, I'll go over here. Symptom management model. This is where we're treating the whole person and we're being proactive. So like for example, if somebody has trouble sleeping, you're going to say, okay, maybe we need to exercise to help increase energy. Maybe this person has some depression. That's why you're not sleeping at night. It's multifactorial. And maybe that will help you sleep better at night. That's just one example. So make sure you understand that. Also, make sure you look over your oncologic emergencies. Make sure you know all of those, the obstructive, metabolic, and infiltrative. You need to know what they are and the symptoms for them. Also, when you're coping with this, again, let's go back to being proactive. Let's say this person is going to lose their hair from chemotherapy. What are you going to do to help them? It's inevitable. They're going to lose their hair. Yes, this chemotherapy causes you to lose your hair. Let's maybe, here's some resources for wigs, or you can wear a bandana. They make really nice ones now, which seems to be the trend. So you're starting ahead of time. Some people shave their head because they know they're going to lose their hair. Radiation, you can get burns to the area where they have radiation. Like if you have radiation in your neck, you will lose your taste. You will have trouble swallowing. You will have a sore throat. You can have some nerve damage from that. So that is all I'm going to talk about for cancer.